Hey guys, Dr. Ray Marquez here, local chiropractor, back pain relief center. We're here today with Eric, and he has some neck pain, and he just works a lot. He works 7 days a week, 2 different jobs, and woke up one day with his neck hurting and a little bit of pain going down his arm. We did an exam and took some x-rays, and he's got some degeneration and some dysfunction in one of his joints in his lower neck and upper back. So we're going to release that compression and loosen up the muscles to get the inflammation down, get his range of motion back, and get him to feel a little better. So the first thing we're going to do is just loosen up the muscles a little bit. So I'm going to put some pressure on these upper trapezius muscles. So Eric, I'm going to put some pressure here. Look this way 5 times. So lift your head up for me. So your head, we're going to do this. 1, 2, okay, 5 times. There we go. 1, 2, 3, 4, 5. Good. Let's do it again for me. 5 times. 1, 2, 3, 4, 5. Good. All right. Try to relax here as much as you can. Now let's do the other side. Okay. 5 times. 1, 2, 3, 4, 5. Good. Again. 1, 2, 3, 4, 5. Good. Now I want you to look straight up and down. So lift head up and down. 1, 2, 5 times. These will hurt a little. 3, 4, 5. Good. I'm sorry. Bad stuff's over. All right. Next, we're going to use an adjusting instrument, and what we're doing is just vibrating the joints in his back to break up any adhesions or scar tissue that may have formed around the joints. He works so much, when you're working 7 days a week in 2 different jobs, you start to get sort of a repetitive stress type injury where it may not be one specific move that irritates your neck or back, but it accumulates over time. And you can build up scar tissue in those joints, and they'll get the joint to dysfunction and cause you pain. Gonna loosen his muscles up a little more. All right, now we're going to do a couple different adjustments. Okay, just nice and light there for me. Good. Okay, on this side. Good. You okay? Yeah. Now we'll do an upper back or upper thoracic adjustment. Take a deep breath for me and let it all out. Good. I'm going to go down just a little lower. Take a deep breath for me. And out. Good. Good. Can you go on your back for me, face up? Just have your hands on your belly. Good. Nice and light. Just kind of drop your head there. Good. One more time. Just drop. Good. Okay. Come back up, and then let's go back on your stomach. Let's go back on your belly. Face down. So it's right down. There we go. Good. All right. Just gotta make sure everything's nice and loose. Good. All right. So what we did with Eric, we did some soft tissue work or myofascial work. You might hear of it a few times. Then we manipulated the joint. Actually, before we did that, we used an instrument to break up adhesions or scar tissue. And then we manipulated the joint to decompress the joint, to take pressure off the discs and nerves, to allow for better function. Next, what we're going to do is we're going to ice this area. We're going to use a little bit of electric stim, put it on our roller bed to loosen up a little more. His home instructions will be to ice every night for me for 20 minutes, and then to give us a follow-up if he's still feeling his pain next week. All right, how we handle all of our patients here is it's a pain relief type treatment. When you feel better, we're done. Some patients, it's a couple visits. Some patients, it's a little more. Whatever works best for you. If you want to see some more videos, go to our YouTube channel, Dr. Ray TV, or one of our websites, backpainrc.com or myrtlebeachwalkinchiro.com. All right, I want to thank everybody for watching, and we'll see you next time.